Hi, my name is Rachel Hobbins, and I'm a registered dietitian with Blue Ridge HealthCare. I am here to talk to you about proper nutrition and why it is important for those individuals that have the diagnosis of cancer. Malnutrition is a common problem in cancer patients that have been recognized as an important component of poor outcomes, including increased morbidity and mortality and decreased quality of life. Good nutrition practices can help cancer patients maintain their body weight and maintain their body's nutritional stores. Good nutrition can also help manage symptoms and improve your quality of life. Nutrition itself is defined as the taking in and use of food and other nourishing material by the body. To give the body proper nutrition, a person has to eat and drink enough food and fluid that contain key nutrients. The disease itself, as well as its treatments, can affect your appetite and how your body tolerates different foods and different nutrients. Nutritional needs will vary from person to person. Meeting with your doctor or your dietitian to discuss your nutritional goals is an excellent start to the management of your disease. These professionals can help you to develop a plan that will work for you. Eating well before, during, and after your cancer treatment can help you feel better, maintain your body weight, tolerate your treatment regimen, deal with side effects, heal and recover faster, keep up your strength and your energy, keep up your body's store of nutrients, and lower your risk of developing infection. What should you eat? The following tips can promote health and reduce the risk of developing another cancer. Number 1, choose a diet with many types of plant-based foods. Try substituting dry beans and peas for meat in some of your dishes each week. Number 2, try to eat at least 5 colorful servings a day of fruits and vegetables, including citrus fruits and dark greens and deep yellows. Number 3, include more high-fiber foods such as beans and whole grains. Number 4, limit high-fat foods, particularly those from animal sources. Try using lower-fat dairy products. And next, choose less salt-cured, smoked, and pickled foods. Examples would be bacon, pork products, and sausage. How can chemotherapy affect your nutritional status? For those of you who are going to the Cancer Center at Valdese Hospital or Grace Hospital, you may receive one of these green books, Chemotherapy and You. Chemotherapy may cause nausea, vomiting, constipation, diarrhea, fatigue, changes in your mouth and throat, and or pain, all of which may affect your appetite and your ability to be able to eat and drink the appropriate amounts of food and fluid. In some cases, you or a loved one may benefit from an oral nutritional supplement such as this. Oral nutritional supplements can be used in addition to a person's usually dietary intake of food. It can be drank between meals to increase the intake of calories and protein throughout the day. In other cases, people would drink these in place of a meal. Supplements come in many different forms. Some are powdered, some are canned, some come in boxes, some come in bottles. They can provide general nutrition, such as the Boost or the Ensure, and some can be disease-specific, such as Glucerna, which is more appropriate for people with diabetes. There are many kinds out there. You can buy them over the counter. You can talk with your doctor or your dietitian about which one might be best for you. How can radiation affect your nutritional status? If you're receiving radiation therapy, especially to the head or the neck, it is especially good for you to take care of your teeth, your gums, your mouth, and your throat. Side effects from treatment to these areas most often include the mouth and may cause it to become sore and dry. Here are a few tips to help you manage those problems. Avoid spicy foods and coarse foods such as raw vegetables, dry crackers, and nuts. Eliminate smoking, chewing tobacco, and drinking alcohol. Stay away from high sugar foods that promote tooth decay. Clean your mouth and teeth often, usually recommended by your dentist or your doctor. And do not use commercial mouthwash products that contain alcohol because this actually could dry your mouth even further. Tips to get more calories and protein. Aim for at least 6 meals and snacks each day. Extra meals and snacks can help you get enough calories and protein. Choose high-calorie drinks. Choose drinks like whole milk, juice, and soda pops with added sugars. Stay away from things like water, tea, and coffee that have no calories. Choose them less often. Choose high-protein foods. These would be in things like milk, eggs, cheese, different kinds of meat products, and beans. You also can get a lot of protein from supplement bars and supplement shakes like we mentioned earlier. Choose higher fat meats in order to increase your calories. Examples would be pork chops, beef brisket, or prime rib. Choose whole milk instead of skim milk, and pick high-fat cheeses instead of low-fat cheeses. If you or your family member are a cancer patient at Blue Ridge HealthCare and you feel that a visit with a dietitian would be helpful, please talk with your doctor about getting you set up for an appointment. All that is needed is the physician referral. Blue Ridge already has a process in place. Once received, we can try to get you scheduled at either Grace or Valdese Hospital as soon as possible. Many people ask, will my insurance cover nutrition therapy? At the current time, Blue Cross Blue Shield of North Carolina will cover outpatient nutrition therapy for diabetes. This includes the state PPO plan, Blue Care, Blue Options, Blue Advantage, and Blue Options HSA. The state health plan offers 4 nutritional counseling office visits with a licensed dietitian. 6 visits will be available for members with a diagnosis of diabetes. Medicare will cover outpatient nutrition therapy for diabetes and kidney disease, but excludes those with dialysis. Medicare does not cover cancer directly. Medicaid will cover outpatient nutrition therapy for any condition that warrants nutrition education up to the age of 20, and will cover outpatient nutrition services for pregnancy with no age limitation. Medicaid also does not cover cancer directly. Other insurance companies may cover the services, but clients will need to contact their individual company to verify. Please note that insurance coverage is likely to change with time. For those that do not have insurance coverage for medical nutrition therapy, the services may still be provided. However, there will be a charge assessed to the client. In some circumstances, indigent funds may be available. Mail-out packets can be made available for those individuals unable to attend a one-on-one session as well. Hopefully, listening to me today has given you some insight as to what a dietitian is and what we do. Hopefully you also learned a little bit about things that you can do to manage your disease or your family member's disease of cancer. And as mentioned, visiting with a dietitian may be helpful, and if it is something that you're interested in, please feel free to speak with your doctor and we would be glad to see you.